Hi, my name is Robin Guzman. I'm here at San Joaquin County Public Health Services, and this is COVID-19 information for licensed child care providers, and I'll be presenting with my colleague, Caitlin Pierce. What is coronavirus? Coronaviruses are from a large family of viruses, including MERS and SARS, and this novel coronavirus is a new strain and originally transmitted from animals to people. Some of the animals that transmitted coronavirus to people have included the civet cat and the camel, and we think with COVID-19, the animal reservoir was the pangolin. How does it spread? The virus spreads mainly from person to person, between people in close contact with one another, through inhaled droplets, touching your face after touching infected surfaces, and it can last up to 72 hours on certain types of surfaces. With this novel coronavirus, most colds and flus are predictable, but before winter 2019, the novel coronavirus had not been seen in humans. Remember that this virus cannot be cured with antibiotics, and there's no vaccine for COVID-19. This exposure risk is harder to contain than bacteria, and the immune response is systemic, meaning the whole body is affected. The symptoms of coronavirus are fever, cough, and shortness of breath, and 1 to 3% of people will experience gastrointestinal issues. The COVID-19 incubation period is most likely 2 to 14 days, which means the time it takes for you to be infected with the virus and for you to become sick and show symptoms. Here's a chart of the number of people that one sick person will infect on average. This is called the R naught. So we're seeing on the far right that measles is the most contagious, and most people, measles will infect an average of 18 people. Hepatitis C on the left will infect an average of 2 people. COVID-19 is probably about as infectious as SARS, and the R naught estimate is 2.2 to 4.2. We're seeing that COVID-19 is more infectious than influenza. The seasonal flu R naught is 1.28. So the R naught estimate for COVID-19 is probably around 2.2. The case fatality rate in Hubei province for COVID-19 was between 2 to 4%. So that's lower than SARS or MERS and higher than the seasonal flu. It's more similar to the 1918 pandemic influenza. Here's some data for San Joaquin County showing the new cases. So in the beginning, the first case in San Joaquin County was a passenger from the Grand Princess cruise ship. And from then on, the few cases that we had were travel related. As the numbers increased, there was evidence of community spread. And this is a chart showing the death rates of COVID-19 in San Joaquin County. This is a chart showing a breakdown of cities in San Joaquin County with confirmed COVID-19 cases. This data is preliminary and subject to change. So we're seeing that Stockton has 92 confirmed cases at around 51%, Tracy with 24 cases around 13%, Lodi with 18, and Pica at 29. We don't have any confirmed cases in Escalon or Ripon. But again, we're seeing a testing shortage. So just because we're not seeing any confirmed cases does not mean that there's no spread in these cities. 65% of all COVID-19 lab tests run for California residents are not yet resulted. So the confirmed number of cases will most likely dramatically increase over the next week as these lab tests are finally resulted. As I mentioned before, there is non-community transmission of COVID-19 in all areas of the county, including all the incorporated cities. And given the limited availability of widespread testing, residents should not assume that the lack of significant positive tests in a specific jurisdiction is any indication that COVID-19 isn't present and spreading within their community. COVID-19 is only reflective of the mailing address. For example, if someone is living in a care facility but their mailing address is someone else, this confirmed case will be attributed to the mailing address and not necessarily where they're living in the care facility. Special populations. For children, there's no evidence that they're more susceptible. It's a low attack rate and usually results in a mild illness. Most of the confirmed cases have been in adults. For pregnant women, it's possible that the immunologic and physiologic changes make them more susceptible, but there's no current information from any scientific report. There's no information on adverse pregnancy outcomes, and it's unknown if a woman can transmit the virus to a fetus. There's no information on transmission of the virus through breast milk. And limited reports state that the virus was not detected in breast milk. Breastfeeding mothers should wear a mask and practice hand hygiene before feeding. Currently in California, we have 16,957 cases of COVID-19 and 442 deaths. Here in San Joaquin County, we have 238 confirmed cases and 14 deaths. For child care providers, Governor Gavin Newsom's state of emergency declaration guides that child care services can remain open for children of parents working in essential sectors. Daycare centers that remain open should employ heightened cleaning and distancing requirements. A new executive order was signed on April 4, 2020, Certain programmatic and administrative requirements are waived in response to the COVID-19 pandemic. Essential workers are prioritized, including healthcare professionals, emergency response personnel, law enforcement, grocery workers, etc. And priority remains for abused and neglected children. And now my colleague Caitlin Pierce will continue with prevention.
Thank you. So the best thing to do, of course, as we know, our public health approach is to wash your hands. Best practice is to wash your hands often with soap and water for at least 20 seconds. It does not have to be hot water, but just as long as you do a full wash for 20 seconds all the way up to the wrist. Use a hand sanitizer that contains at least 60% alcohol if you don't have soap and water available. And avoid touching your hands, touching your eyes, nose, and mouth with unwashed hands. So remember that hands that look clean can still have germs on them. Remind your clients and your staff to wash their hands properly to keep them healthy. Some helpful songs to sing to make sure you wash your hands for 20 seconds include singing Happy Birthday twice. Row, row, row your boat is very popular as well. Twinkle, twinkle, little star, ABCs, Mary Had a Little Lamb, If You're Happy and You Know It, and Frere Jacques. You can also sing your favorite Disney song or song on the radio as long as it's about 20 seconds. Avoid close contact. So avoiding close contact with others, especially people who are sick, is incredibly important at this time. Practicing social distancing means keeping at least 6 feet between you and other people. So when you walk by another person, make sure you keep that boundary between the two of you. For staff, stay home if you have respiratory symptoms like a cough or shortness of breath, or if you have a sustained fever over 100 degrees. Avoid shaking hands in your facility. Hugging and other intimate greetings can also help facilitate that transmission of the virus. Meet your parents and caregivers at the door instead of inviting them into the facility. This will help eliminate that opportunity for close contact and that keep that barrier between people for social distancing. Requiring your parents, caregivers, and children to wash their hands thoroughly when they enter your facility. That way, when they come in, they're keeping their hands clean and practicing that habit right away. And separate your groups of children with key care providers. Assign one care provider for a set of children in a cohort manner. You can also try rearranging your furniture to facilitate social distancing and keeping children separated from other groups. You can try using rope or other means that kind of help to remind others to keep their distance. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Make sure you throw your used tissue in the trash and immediately wash your hands afterward with soap and water for at least 20 seconds. Cleaning and disinfecting frequently touched surfaces should be done daily, if not multiple times throughout the day. If a surface is dirty visibly, make sure you clean it with soap and water. Use gloves when you pick up used tissues or emptying waste baskets, and make sure to wash your hands afterward. Linens, eating utensils, and dishes do not need to be cleaned separately from other dishes or linens or things, but they should not be shared without thoroughly washing them. Using regular detergents or laundry soap should be fine to kill the virus as long as they're in the heat cycle. For a full list of cleaning disinfectants, and you can go to the EPA website. There is a list of recommended disinfectants. So Governor Newsom had established a stay-at-home order earlier in March, and this included that there were some businesses that were to remain closed and some that remain open. So essential services that remain open, of course, include grocery stores and food banks, pharmacies and healthcare providers, restaurants, but only for takeout, delivery, or drive-through, laundromats, banks, farmers markets, gas stations and convenience stores, government services, public transportation and utilities, and of course, child care providers for children of essential services. Things that were to be closed include dine-in restaurants, theaters, and entertainment venues, bowling alleys, arcades, gyms, and fitness studios, and bars and nightclubs. So what can you do with your facility? The number one thing we're trying to enforce right now is to create a preparedness plan. Make sure in your facility that you talk with those who need to be included in your plan. Make sure families are aware of what your procedures are if something were to happen in your facility. Make sure that you also communicate those plans with your healthcare partners locally. If you need to refer children or families to other places, that would be a good idea to keep a list of key contacts and other partners who should know your plan, including the health department, maybe your licensing board as well. Include contingency plans for increased absenteeism for staff. It is likely that people will get sick with COVID-19 at some point. It's very contagious and it is spreading throughout the community. And you may have staff who are at home caring for someone who has COVID-19 or is sick from something else, or they may be afraid to go out and do their essential services. So making sure that you have a contingency plan in place for that kind of expected absenteeism. Make sure to update your sick and medical leave policies. Many companies are expanding this to 2 weeks for COVID-19, allowing people to take up to that amount of time if they do get sick or need to care for someone who is sick. It would be a good idea to also refresh your memory on maybe your own agency's policies that are already existing or in place, and also your own agency's policies for preventing the spread of infectious diseases, because COVID-19 is like every other infectious disease that we have, like tuberculosis or influenza. Public health approaches like washing your things and social distancing and things like that are best practices right now. So keep your clients and guests informed. Post signs that remind people to cover their cough and wash their hands often. address potential language, cultural, and disability barriers, and encourage ill staff and volunteers to stay home or be sent home if they develop symptoms while at work. This will help to prevent transmission of infection to other people. Reducing the spread of COVID-19. Avoid sharing personal items. So don't share dishes, drinking glasses, cups, eating utensils, towels, or bedding, especially without washing them. I know children sometimes will share things amongst themselves, and so it's a good idea to keep an eye on them and make sure they're not sharing these things. Make sure all of the items are washed thoroughly after use with soap and water, or you can put them in the dishwasher or clothes washer if it's bedding and towels and things. Isolate symptomatic clients. If you have a child who may develop symptoms while they're at the facility, make sure to separate them from others right away and call their parent or caregiver to pick them up. Face masks. If you or a child is sick, wear a face mask or ask them to wear a face mask when they're around other people, or before entering a healthcare provider's office if you are going into your doctor's office. If the person who is sick is not able to wear a face mask, for example, because of trouble breathing, this is a particular issue for children with asthma, then you can just ask them to stay separate from everyone else. That way, if they're not covering their coughs, or at least separated from everyone and preventing those aerosolized droplets from coming in contact with everyone else. The California Department of Public Health recently released guidance on the use of cloth face coverings may be a benefit to reducing asymptomatic transmission of COVID-19 and reinforcing the physical distancing from the use of a face covering. So right now, here in San Joaquin County, we are recommending that people wear face coverings only if you feel comfortable doing so, and practice strict hand washing before and after touching and adjusting the mask. This prevents you from transmitting the virus onto the face mask and then putting that face mask directly onto your face. Best practice is to use a face covering in conjunction with social distancing and frequent hand washing throughout the day. Cloth face masks can be made at home, but make sure that they fit snugly and comfortably against the side of the face. It should be secured with ties around the back of the head and the nape of the neck or through ear loops. Include multiple layers of fabric, and it should allow for breathing without restriction. Face coverings should be able to be laundered and machine dried without damage or change to the shape. If you are interested in making your own face covering at home, there are directions and guides on the CDC website, and CDC recommends wearing a face cloth covering in public settings where other social distancing measures are difficult to maintain. One of the main takeaways we would like to promote here is that face coverings, although they do have some protective factors, it is always best paired with hand washing and social distancing, and so one is not better than the other. Using all forms of prevention is the best approach. Make sure you can monitor client symptoms throughout the day. If, for example, you have a child that comes in and they're sick, they might be fine at the beginning and later they feel ill, you can check their temperature throughout the day. Maybe you're at home and you're taking care of someone who is ill, or you yourself becomes ill. You want to make sure that you understand how to monitor your symptoms. So following care instructions is really important. That should come from a healthcare provider, or a local health department also has guidance. And the CDC also has a list of how to monitor your symptoms and manage the disease. Emergency warning signs for COVID-19 require immediate medical attention. For example, hospitalization. This includes difficulty breathing or shortness of breath, persistent pain or pressure in the chest that lasts, and new confusion or inability to rouse or wake, and bluish lips or face, which indicates that the person is having a difficult time actually getting oxygen into their body. If any of those symptoms are present, make sure that you call 911 right away. Again, call 911 if you have a medical emergency. If a client has a medical emergency, make sure you notify the operator that you think they might have COVID-19. This will give the operator and whoever the response team is opportunity to prepare themselves to take that COVID-19 patient. They can prepare personal protective equipment for themselves or prepare their transport vehicle for transporting someone who is potentially infectious. And if possible, provide your client or the child who is sick with a face mask before medical help arrives. Say that you will have a child or family member who was isolated because they either had or were suspected to have COVID-19, and then they need to discontinue isolation. So it's important to know how to discontinue isolation. It can be discontinued after these three things have happened. So number one, the person has not had a fever for at least 72 hours or 3 days, and other symptoms have improved. Number three is 7 days have passed since the symptoms first appeared. Once all three things have happened, the person can discontinue isolation safely. They're no longer considered infectious. As a child care provider, it's really important to keep in mind that stigma and privacy are utmost importance right now. Public health emergencies are very stressful for families, for children, especially for people who are required to continue working. Fear and anxiety can lead to stigma and discrimination of people, places, and things associated with the disease. Stigma can also occur after someone is released from quarantine. Ensure privacy of students and staff to help prevent discrimination or unnecessary stigma based on their country of origin, particularly those of Asian descent, their health status, or people who have recently traveled. After someone is released from quarantine, even though they're not considered a risk of spreading the virus to others, that stigma can have lasting effects on them and their community. Other adverse outcomes. People may respond more strongly to the stress of a crisis, particularly older adults and people with chronic diseases who are at higher risk for COVID-19 and their severe side effects. Children and teens often don't know how to react or how to handle the information or don't understand what it means, and that can be stressful. People who are helping with the response to COVID-19, frontline workers, deal with all of this right in their face all day long, and of course, once they come out back into the world, it can be overwhelming. And they carry on with their day-to-day lives. It carries over. And people who have mental health conditions, including problems with substance abuse, can sometimes have overarching anxieties that kind of come through in periods of crisis like this. Not all children and teens respond to stress in the same way, but we do know that children and teens react to what they see from adults around them. Talk to children about what is happening in a way that they can understand. Keep it simple and appropriate for each child's age. Reassure your child or teen that they're safe. Let them know that it's okay to feel upset, and share with them how you deal with your own stress so that they can learn how to cope from you. And be a role model. Take breaks and get plenty of sleep, exercise and eat well, connect with your friends and family members, and try to keep up on regular routines. If schools are closed, create a schedule for learning activities and relaxing or fun activities. Remain calm. There are some things that you can do to support yourself. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, and meditate. Try to eat healthy, well-balanced meals. Exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Take time to unwind. Try to do some other activities you enjoy. And talk with others. Talk with people you trust about your concerns and how you're feeling, by phone or with video chat. And calling your healthcare provider if stress gets in the way of your daily activities for several days in a row. Right now, it's really important to prepare for change. Again, review your organization's emergency plans and discuss staffing support, client resources, and other operational considerations that may impact how your services are provided to your clients. If you or your clients need extra support, there's a couple hotlines that we would recommend reaching out to. The Substance Abuse and Mental Health Services Association Disaster Distress Helpline is available. They have a toll-free line that's available 24 hours a day in English and in Spanish, and they also have text-to-talk lines. Their websites have great resources as well. The National Suicide Prevention Lifeline is a great resource for someone who might need to be talked down from potential thoughts of suicide, or if they're deeply depressed or just need an outlet. Some local resources include San Joaquin County Behavioral Health Services. They have a warm line where they can actively talk to people about whatever issues they're going through. If you have someone who needs to be talked down from a crisis, they might be ready to do something that they will regret later. They have a mental health crisis line as well. There's a wellness center of San Joaquin County and also a wellness center in Manteca. The wellness center in Manteca, although they are closed, they do have a list of resources that they have available for people if they come in person. What is public health doing in the midst of this COVID-19 response? Public health is maintaining regular contact with and following the guidance from the Centers for Disease Control and Prevention and the California Department of Public Health. They're conducting planning meetings with our programs and partners to allow for enhanced response coordination. And we're working to ensure that our healthcare systems, first responders, and schools have all the guidance that they need. Public Health Services is maintaining communication and outreach with federal, state, and local partners. We're distributing as much information as we can and updates to healthcare professionals and educational settings. We're also reviewing and adopting pandemic response plans for COVID-19. For up-to-date information, use the resources below. You can call San Joaquin County 211 for community resources, or visit the following sites for updated information: www.sjcphs.org or sjready.org. Next, we have some frequently asked questions that came from our child care providers, and we did ask our operating partners what their best answers were, and also the medical director. So the first question was, should providers start to wear face masks now, and which type? So the answer is, it's really a personal choice. You can use a cloth face covering if you prefer, but it's really up to you and if you are comfortable using it. But of course, remember, keep social distancing and hand washing as your #1 preventive approach. Our second question was, for child welfare cases, can at-risk of abused children continue to attend pre-K settings where they will be in a safer environment? Given the stress on the adults at this time, it will likely trigger child abuse. Will public health state this publicly in information regarding who can attend pre-K or child care settings? So the answer is yes. Dr. Park, our medical officer for Public Health County, or San Joaquin County, said she will allow this, and recent guidance came from the California Department of Public Health and Gavin Newsom. They advised that this new guidance will prioritize children of essential service workers, and it will not impact the priority for abused and neglected children. And the last question, are there public testing sites? The answer is no. You will need to be referred by your primary care provider or regular source of care. They will do a screening of your symptoms. It asks if you've had contact with known cases, and they'll ask if you have any other risk factors to assess whether or not you need to be tested for COVID-19. Public Health is working on compiling a list of medical providers and sites throughout the county who can do this assessment for COVID-19 testing, and if testing is appropriate. Only then will people be referred to a testing site. So the answer is yes, there is testing sites in our county, but they are not public. And they are not readily available for public access without that referral or appointment.
What do I do if a parent has been tested positive? The answer is COVID-19 positive individuals should self-isolate at home. If they have children, the parent should isolate in a separate room in their house and use a separate bathroom if possible. Communicate with parents and guardians that children should stay home if they are sick, or even if they have been in contact with a person who has tested positive for coronavirus, even if it's a parent. And this answer came from Cal OSHA. Do I need to get tested if I have had a close encounter with someone who has tested positive? You can choose to self-isolate, but testing will not be available unless you have severe symptoms. There may be exceptions for public testing. And again, this is a rapidly evolving situation, so please stay updated on the availability of drive-through tests. Does the stay-at-home order apply to me since I am caring for children? It does not apply to you. Governor Newsom has declared that workers supporting public and private child care establishments are essential workers.
The last question was, how do I social distance while caring for children? There has been some guidance from the California State Licensing Board about how to reinforce social distancing, like moving furniture, separating children into groups or cohorts, separating them by using ropes or traffic cones or any kind of visible indicator that shows that we are keeping our distance from each other is a good way to reinforce that social distancing. Be creative with it. You can always, play telephone in a creative way, or however you guys can think of ways to reinforce that social distancing. Really, the importance is to keep one child care provider with a group of children over the span of their time in the child care setting. So during the whole week, make sure you have that same person and they're not cycling through different care providers or oversight. It's also best to limit the number of volunteers or parent volunteers at this time. If possible, you can go without. And I know sometimes that's a difficult thing because we rely on our volunteers, but that will be another way to limit the exposure risk for children and for staff and volunteers. So that is our presentation. If you have any questions, you can always reach out to San Joaquin County Public Health Services, again at SJC PHS. Thank you.